This is KSUT Public Radio. Regional news is next. There's growing concern in rural communities about how the Republicans', quote, big beautiful bill, unquote, could affect local hospitals. Critics warn that cuts to Medicaid included in that bill could leave rural facilities struggling to serve patients who already face long drives and limited options for care. Jace DeCola is the health and wellness reporter for the Daily Sentinel in Grand Junction. He's been writing about how rural hospitals are bracing for the impacts of the bill. The Rocky Mountain Community Radio Coalition's Maeve Conran spoke with him to find out more. And here's their conversation.
Jace, I know when the budget bill was passed, there was a lot of concern expressed about the possible closure of rural hospitals. And in fact, a Senate commissioned analysis of rural hospital stability that was released in June identified 6 hospitals in Colorado that were in danger of closure. I know some of the folks involved in those hospitals actually pushed back on that. What did you find out about the possibility of some of these rural hospitals closing?
The 2 hospitals on that list that I'd looked into that are in the Western Colorado region were the Grand River Hospital District and the Delta Health Hospital. And they actually, while they're both on the list, they have very different outlooks on what their viability is. And a main takeaway that they do share is that there's no immediate risk of closure, and there isn't really much of a long-term risk of the entire system closing down. And down in Delta Health, Jonathan Cohey, the chief executive officer there, had mentioned that the more likely possibility is a reduction in services, which, unrelated to the big beautiful bill, has already sort of panned out down there with their labor and delivery unit recently closing actually this week. But that was more related to provider shortages than anything else. But that is an example of what the future could look like, according to that CEO. More of those services either being shuttered or being consolidated with other hospital systems like Montrose Regional Health. On the Grand River Hospital District side, another one of the hospitals on that list, their CEO, Jim Coombs, had told me that the hospital hasn't been more fiscally sound in more than a decade, actually. They currently have just over 180 days of cash on hand, which is a pretty common way of measuring hospital solvency. It essentially estimates how many days a facility could pay its cash expenses with its reserves alone. The idea is that the higher the number, the longer a hospital could survive with a low or negative operating margin. That's the main takeaway, is that neither of these hospital CEOs want the community to think that either hospital or its services could disappear anytime soon in its entirety. But there are some in jeopardy in certain rural hospitals that already have struggles, like Delta Health. There have been financial struggles for that hospital over the last couple of years, and this is a development that really only adds strain to it.
Well, in terms of the fiscal reality of the One Big Beautiful Bill Act, a lot of the concern is around the reduction in Medicaid, because a lot of the patients who use the services in rural hospitals rely on Medicaid. And so if they're not on that program, or if the implementation of the work requirements change people's eligibility to participate in this program, that will have major implications for the amount of uninsured folks that these hospitals would potentially have to deal with and serve.
An interesting point to make is that the implementation of work requirements wouldn't necessarily reduce coverage for just people who are ineligible. So the Colorado Department of Healthcare Policy and Financing is predicting that the implementation of work requirements, which in this case would be at least twice a year, if not more frequent, would provide a lot of different and new barriers to enrollment for current enrollees. So think about maybe people who don't have access to a computer or Wi-Fi, or might not have the wherewithal or the time or the ability to obtain all of the proper documentation that they are working and submit it to the right portal, assuming that the portal is operational, and have all of that done within time for approval. In addition to that, the state will be responsible for setting up that system, and the rules around what that system has to look like and the fine details of the work requirements still have yet to be determined. So it's going to be a bit of a mad dash from the state to set that up. But to your original question, absolutely, regardless of whether it's just the intended population or the much broader population, which a lot of experts think will be impacted, any reduction in a hospital's Medicaid population can be problematic in various ways. One of the most obvious ways is that there is simply going to be a higher amount of uninsured people. Mostly if people are getting disenrolled from Medicaid, they don't have the funds or the ability to acquire their own private insurance. And so they will either not seek care or they will seek care at the emergency department where it's most expensive. And all of that cost will be passed on to the hospital. And it's either going to be passed on to private insurers from the hospital, or the hospital has to eat it. And that obviously impacts their finances. Another component of that I'll briefly touch on is how Medicaid populations can impact a hospital's eligibility for financial assistance programs like the 340B federal drug pricing program. It allows hospitals to access huge major discounts from pharmaceutical companies. It's not a subsidized tax dollar sort of situation. Rather, it's the pharmaceutical companies have made an agreement to sell them at a discount without really any incentive or back payment. But hospitals' eligibility for that program depends on how many Medicaid patients they serve. The chief executive officer for Montrose Regional Health had told me that obtaining that eligibility can come down to 50 to 100 Medicaid patients being seen inpatient in a hospital. And so if there are less Medicaid patients being seen at these rural hospitals, they face higher odds of not qualifying for that program, which happened to Delta Health last year and cost them a cool couple of $1 million.
Jay Stacola is the health and wellness reporter at the Grand Junction Daily Sentinel. You can read his reporting online at gjsentinel.com. Jace, thank you so much for taking time to talk to me.
Thank you so much for asking these great questions.
For Rocky Mountain Community Radio, I'm Maeve Conran.
You're listening to Regional News on KSUT Public Radio. Governor Jared Polis announced more than $250 million in cuts and funding changes yesterday to help close the hole in Colorado's budget created by Republicans' federal spending bill. As KUNC's Lucas Brady Woods reports, the single largest cut will be to state Medicaid reimbursements.
That part of the governor's proposal will reverse an increase to how much the state reimburses healthcare providers who serve Medicaid recipients. Other cuts are spread across the budget, but the majority slash spending for public health initiatives and higher education. Polis says the plan does not touch funding for public schools or public safety.
We want to show that we're continuing our commitment to fully fund our schools. We also have zero cuts to public safety. One of our goals, as you know, is making Colorado one of the safest states.
The cuts will take effect next month. They'll cover about a third of the budget deficit. The Colorado legislature took steps to fill the other two-thirds during their special session earlier this week.
Content produced by the Colorado Capital News Alliance is funded in part by the Corporation for Public Broadcasting. Support also comes from the Colorado Housing and Finance Authority.
Support for public policy reporting comes from the Gay and Lesbian Fund for Colorado, promoting programs designed to ensure all Coloradans have the same opportunity to thrive. More information is online at gayandlesbianfund.org.